So when we talk about borderline personality disorder and major depressive disorder, there is significant symptom overlap. And these symptom overlap, what happens is that those with borderline personality disorder, that they tend to have a sullen presentation that mimics depressive symptoms. Okay? Certainly suicide risk, self-harm, which is also seen in those with a major depressive disorder. There's affective instability in those with borderline personality disorder and traits. And this manifests because we're talking about depression, that overlap. That's an intense episodic dysphoria, okay, when we see it in borderline personality disorder. But also, you can see some of that, remember we talked about anxious distress, you can see that as well. Because you can see folks that are presenting with this very sullen, dysphoric, sad, melancholic presentation, but it's frequent temper outbursts in these folks, agitation, irritability, this mimics that major depressive disorder with anxious distress. Okay? And individuals with borderline personality disorder tend to experience senses of emptiness, which is also commonly reported in those with major depressive disorder. And then there's also this stress-related paranoia for some of those folks that are on that borderline personality disorder spectrum, and they have dissociative symptoms. And this mimics depressive with psychotic features at times. Now, depression with psychotic features, that is those that are so depressed that they start to hallucinate. And that can often be confused. Some mental health providers can be confused and think that it is hallucination and delusion, and it's actually dissociative episodes. So we have to educate ourselves, certainly as mental health providers, but also as individuals that experience this disorder, so that sometimes we have to clarify what symptoms we're actually seeing, and we're going to talk more about that in just a minute. Okay? So that's that symptom overlap. Well, depression in borderline personality disorder, but it's not actually a depressive disorder in some cases. So let's talk about that real briefly. So now we know that depressive symptoms, because 83%, depressive symptoms occur in those with borderline personality disorder. But in those with borderline personality disorder, if it's not depression, okay, so now we're going to step outside of major depressive disorder. And this is for folks that just have borderline personality disorder, okay? Not just like I'm minimizing it, but just that it's not comorbid, which means it occurs together with major depressive disorder and borderline personality disorder. So these are just folks that only have borderline personality disorder. And if they don't have major depressive disorder, what you see is you'll see an identifiable stressor, okay? And this is an instance which could be rejection, perceived abandonment, some type of issue. But what happens is once that episode, that identifiable stressor remits or attenuates, which means that it goes away, it resolves,